If you've never been to a physiotherapy session, this is a video for you to watch and learn. You will see how helpful it is to have someone who will work with you to find the reason of your problems and how to fix it. Let's go. Jordan Craig from Back to Bounce, Jordy, is the guy who took care of my knee, my second ACL reconstruction. Well, he's amazing. He's not only super knowledgeable, he's a great guy, so he's a good guy to be around. And I want him to have a look on this pain I've been feeling on my right groin. I have commented with you guys before. I have felt my left groin for a while. I've trained that like it was an adductor tendonitis. And then after I increased the volume of training with the running, with the weight training, I start to feel more on my right. It's feeling so much better now that I'm resting more. I'm not doing the same volume of, especially weight training. Now I want to check if everything is normal, if I have some muscular imbalance, which is expected for someone who did 2 ACL reconstructions, and to see if he finds anything that could clarify this pain and we can treat it. So I can move on with the program to run a marathon in 1 year. Before we start, I would ask you to like this video. It helps so much me to grow the channel, to bring more visibility to the channel so more people can find me. And comment here below if you have been through a knee injury or a hip injury. The more you interact, more you help me to grow the channel. So let's go inside.
Do you want to do, because I probably need to just get a few questions about your training load and stuff like that. Happy with that?
Happy with that.
All right. So, give me a bit of a rundown, man, to when did you first feel the symptoms of the groin?
Well, let me see. Because I'm methodic, right? I'm gonna know exactly when was it. That was probably around March, beginning of March. I started to feel the left groin. And then I did a few tests to see if it would be more internal or external. Seemed to be more external. So I did some Copenhagen. I did
when
some...
you say external, like external rotation?
No.
Like muscle, not
extra joint.
Extra,
So it felt more like muscle instead of feeling more joint related.
Good.
So I started to do some Copenhagen. I was explaining to Jordy that I felt first at my left groin, and then I treated like a tendonitis. It fixed it. And then I started to feel more on my right. And then even after the same treatment I did on the left, it improved, but not totally fixed. I did 1 month of my program, the running program. And then on the 5th week was supposed to be a decrease in volume to rest 2 weeks ago. And then at the same time I did less running and I took the week off. I decided to take the week off of the leg exercise as well.
And roughly, mate, when you say you've had the groin pain for a long time, how long are we talking?
We're talking a good 3 months maybe. So, on the left groin.
So is that March or before March?
Before March.
Before March.
Like January.
So January.
This year.
So the first time you ever felt groin pain was January this year. Okay. And that was with the Bulgarians and the Stairmaster, right? Is there anything else like movement pattern wise that you do that irritates your groin? So if I said go and ping it off, what would you do?
I would say anything that is unilateral based. I don't know, I just don't want to force it.
Yeah, okay. And have you found anything to make it feel better? Have you found anything that relieves it?
Yeah, so every time I have the bend and I hold internally, try to do isometric with adduction isometric, it feels good. Every time I was doing the isometric leg press, holding on the bottom, it felt good. And this is another reason why I thought there would be more tendonitis. Because it got better.
It got better with load.
With release and load. I'm telling Jordy that since I'm wearing my barefoot shoes, I could feel the difference in pressure on my feet. That I bear much more my weight on my left than I was doing on the right. And now I can equalize that. Also equalizing the pressure between my heels and my toes. It's been a game changing for me. Wearing the barefoot shoes and strengthening my feet. And it's interesting that you ask, did I rupture my ACL because I prone too much? Or do I prone too much because I had my ACL? Which I don't know.
When did you go into those shoes?
In maybe November last year.
injury-wise, we've got a right ACL reconstruction.
Yeah, 2.
By 2. Cool. In terms of any other previous injury history, so you did a little hemi strain.
Yeah.
Okay.
After that, no.
Okay, cool, yep. And no other, before that, no foot, ankle, hip, knee concerns?
Ankle, yes.
Okay. Which ankle?
Right ankle. It's definitely volume related. Because I increase the volume, hurts more. I drop the volume, hurts less.
Yeah. Which is then, we've got to figure out this whole external load, which is it just purely a load issue, or internally, where's the breakdown? Why is it not coping with this increased load? Does that make sense?
Yeah.
So if you're sitting around here and it's not stressing the tissue and the biomechanics enough to then now these errors come out, 10% error or asymmetry, then on the high load, they're going to rear their head. But down at 30%, you're not stressing it enough for it to be a problem or a load to the joint or the tendon, right?
Got it.
So, so essentially in a simple sense, what we know the issue here in your story is that it's a loading issue. Now that's volume, intensity, duration, or whatever. So if we sort of split this here, this is the external load, right? So external load is how much weight you put on it, how far you run, intensity, all that sort of stuff. So essentially what we call frequency, intensity, duration, volume, right? So those 4 factors is what we look at in terms of your training load. And we've got lots and lots of good data at the moment that if we increase that training load too quickly on your chronic workload or what you've earned or trained your body to do, there is a much higher risk, 2-3-fold risk of soft tissue injury, right? So that's what we want to make sure with you have done, your 10% per week. Perhaps we just got to check, is that too quick? Do we need to just make that a little bit slower in your volume and resilience, and we earn the right? Is something we may need to consider. But the other side of things in here today is this internal load. So as in what is providing the load to your groin. So that might be restrictions in range of motion or of hip, big toe, hip, knee, ankle, right?
Yeah.
It might be strength of all of those above. It might be functionality or kinetic change. So there's many things that can lead to biomechanical inefficiencies to absorb load. Does that make sense?
Yeah.
So therefore for you in the groin, we need to figure out perhaps what are some of those things: range, strength, function, balance. Is out of those impairments, is there anything asymmetrically that could be loading your left groin than your right groin? From a diagnosis point of view, what are we dealing with? Are we dealing with an adductor tendon? Are we dealing with the pubic symphysis, like the joint? Are we dealing with the pubic bone? Are we dealing with lumbar spine, hip, SIJ? Multiple things can produce pain to the groin.
Then we started the first physical tests, measuring my ankle mobility. What are the angles I reach with my right and my left? If there's any difference between them. And then strength on my ankle. All the directions my ankle moves. And again, the differences between right and left. Then we moved into knee, how much knee flexion I can get. And the tests with hip mobility. Differences between internal, external rotation, right and left. And then he also worked on the strength, especially adductor strength when I close my legs. With bent knees and extended knees. In there as well.
Yeah, so that's your adductor tendon.
Yeah.
That's right on like the insertion, right? This is then a little bit deeper, right? This is then off down onto your radius insertion.
That's hurt.
Okay. Can I do the same to this side?
Leg, right leg up. Yep, lie down. Okay. In that position, any soreness into the right groin?
Nah.
And if I was to add a bit of pressure in through there, Lucas, any soreness in the right groin?
Nah.
Can you push your left leg up towards my hand, towards the roof? How does that feel?
Oh, yeah.
Can you squeeze the left leg into my leg for me? Any problems there?
Nah.
Good. Now, if we can swap over. Yep. And then in that position, mate, if I was to do that, any problems at all there into the groin?
Nah.
Okay. Can you push your right leg up into my hand for me? Good. How does that feel?
A little.
Yep. Where?
More in this region.
Right. Okay. Can you squeeze into my leg for me? Okay. Ready?
Yeah.
Can you push straight up?
Yeah.
2, 1, go. Go, 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 go. Push, 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 push. Good. Go, mate. Go, 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 go. Push, 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 push. Good. And then relax. Nice. Okay. So hip extension wise, like your glute max, this is right, that's left. So just bear with me here. Your right was 15% stronger than your left. Yep. On your glute hip extension, right? And then lie down. That's actually, I reckon, be pretty sweet. 2, 1, go. Go hard, go hard, go hard, go, 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 go. Good. And then relax. That feel okay?
Yeah.
And then push out for me, Lucas. Ready?
Yeah.
Go. Push, 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 push. Beautiful. And relax. Okay.
Didn't hurt.
No. So that's you adduction long lever, right? Full load, equal. Beautiful. 176 right, 176 left, 175 right, 1% difference. Abduction, 181, 183. Technically, yes, I would like a little bit more strength in your adductors. You can see that you're actually better long lever than you are short lever, right?
It's what I've been training.
Yeah.
Standing with a band.
So the only thing is because that you're definitely weaker in short lever. It's also a bit more painful, right? And I'll explain why that might be. But from a muscle performance, you're actually reasonably good, right? So we're condition-wise, we want the ratio about 1 to 1.2. Pretty much right where I want you to be.
Okay.
Yep, the groin could be a little bit stronger. Always like the groin to be a little bit stronger than the adductors in a male, particularly running. But having strong abductors, stabilizers, with a knee history, you're not going to hear me complain.
Yeah.
Yeah, and go. Push, 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 push. Go, 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 go hard, go hard, go hard, go hard. Yep, good job. Well done, mate. From a knee perspective or a quad perspective, we basically have here 1.5% difference. Stronger on the right.
Okay.
From an ACL perspective, quads, perfect.
Right.
Absolutely perfect. Good. Okay, you ready?
Yeah.
Full noise. 2, 1, go. Go, 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 go hard, go hard, go hard, go hard, go hard, go hard. Good. And you're all. Okay, ready?
Yeah.
2, 1, go. Build up, build up, build up. Go, 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 go. Yeah, good job. And then we'll up. 1.7% difference, 35 and 34. Looking pretty good. So from muscle component of view, you're looking reasonably good, right? So I'm happy with how your muscles of your hip extensors, muscles of your adductors, abductors, and your quads and hammies, from a strength perspective, all looking reasonably good levels and good symmetry, right? Happy with that. So mate, from here, I want you to stand in the middle. You're going to go from your right leg onto your left and just stay there for 5 seconds. Come off, go from your left onto your right, balance for 5 seconds. Do it up or do a bit of a step, sort of step jump. And then balance control. Good job. Okay, pop off. Now onto the right side, ready, go. Good. And then pop off. So no major difference there. To be honest, your right was slightly better than your left, right?
Oh, good.
All right, you can come on into here now, mate. We'll sort of summarize that.
Essentially, if I just cut to the chase, right? Like in terms of, if we go back to like the diagnosis or the cause of what I think your pain's coming from, what I have to essentially rule out today is to rule out that there is any sort of bony type, even pubic symphysis type information here, because there is some tests that I do that I can't rule that out. You're tender along that bone away from the adductor tendon. The adductor tendon is a very localized area, and when I go around that more posteriorly, that's where I make you jump, right? So it's not saying that it's not the adductor tendon only, but I just want to make sure for our plan forward that I have ruled that out and that there is no underlying bony issue there, because that definitely changes my management to where if it's just an adductor tendon getting loaded, right? Because you're a little bit tender through the pubic symphysis, you're a bit tender each side of the pubic body, and then as I come down that ramus, it's a bit tender. So then when I do your bent knee groin squeeze, it's quite uncomfortable. So when you're long lever, that's a lot of adductor longus, right? Yeah. And it was better, and your strength out there was good. So if it's an adductor tendon and it's not overly irritable, and I'd say, let's go hard. The challenge to that is if it's actually the little bit of bone that's adjusted to the loading a bit, and it's the bony interface that the adductor tendon pulls on it's not the tendon, it's the bone.
Yeah.
I make you do more, it gets worse. And we're sitting on the sidelines far more than we need to be.
Yeah.
So I would recommend that we do an MRI to rule that in or out. That will give much more clarity to exactly what we should be doing.
Beautiful.
Because just in your assessment, it's quite nice. I don't have anything glaringly that's like stop the train. Like we need to fix that first no matter what happens. The worst I could find was 15% different on your left hip extension. So what we need to do is go, all right, we'll get a plan ready for that. But if it ain't broke, don't fix it at the moment. Is it just a response to your loading and your running and that deep squatting in those positions that accumulatively was a bit much for the groin and pelvis? Because at the moment, your knee looks really good from a strength. I haven't looked at power yet, so we can always do that later. But from today, range and power, Lucas, I don't have a huge repertoire of things that are looking poor. Your right ankle definitely has some more physiological laxity to it, but from the best that I can test it simply today in a time frame is that they looked okay from a stability point of view.
Right.
We could explore that in more detail if we needed. But if the two things I was to pick would be that right ankle and the left hip strength, right? This stage, I could explain the pain on the bent knee squeeze test by potentially some pubic symphysis or some bony involvement because it's painful, right? Because your raw score's too low. You scored about 140. I need you at least 180 to 200. A guy your size should have at least mid 200s. But is it weaker or down because it's painful? Quite possibly. Normally that bent knee squeeze test is a really nice identifier for loading and how your body's going, responding to load. We used to use it in soccer players all the time. Every couple of days we'd manage their load. We'd see when it would drop off. That's a flag, careful, right? So perhaps that's a sign that you are quite fatigued through your pelvis and your groin and that we just need some time for that to recover. And if I did it again in 2 weeks after your already first block, we would see that that's gotten a bit better.
Yeah.
So I just want to go bite the bullet. Structurally, do I need to pull you back? If not, great. Let's now build you back up on this time frame, knowing I'm not going to make anything worse.
Right.
We could do it the other way and just monitor it and strengthen it, but it would just keep a little bit of grey area, and that can be time lost. In your program, I don't want to lose time. So that's why I'd recommend that pathway.
Great. So, and I do the MRI, we book another talk. But from now to then, should I just continue what I'm doing now?
Absolutely.
That is not irritating?
Absolutely. Keep your loads low. Don't go down in deep squat positions. Your adductor loading I'm okay with. Just be making sure, because you said it feels more comfortable doing that. It should. So keep doing that. Don't bias the bent knee stuff or the short knee yet until I see that, because I don't want to go hard and it makes it worse. So just keep doing that same program. We'll just look at what the image tells us if we're at any reason we should stop. Otherwise, we'll form a plan of short lever, a little bit more left hip extension, monitor the load, a little bit more exploration into your ankle foot control and that arch with these shoes, and perhaps that will help us get along. But at this stage, I just need to rule that in and out.
Beautiful. All right, you saw the results. Pretty cool, isn't it? I mean, I love it. I love to come here and check and start the hypothesis. Very surprised, positively surprised with the symmetry between my right and left leg on quads, internal strength, outside strength, glutes would be the imbalance between my left glute and my right glute. My left glute is weaker. We can fix during the sessions. But before we move forward to see if I need to change anything in my program, he asked me to do an MRI. I have here a referral for an MRI just to check if the pain is coming from the tendon itself and if it's a tendonitis, or if the pain is coming from the bone where the tendon is attached. Because if we increase the load and we do everything to improve the tendon, but the pain is coming from the place where my tendon is anchored, I will increase the pulling on my tendon and it will potentially make it worse because it's anchored on something that is not fully solid. Basically, that's what we're going to figure out. So I'm going to book my MRI and see what are the results. Probably I'm going to put everything in the same video so you can see everything in details. So check the past videos to see how my training is going. Give me a like on all of them. Share with your friends that like to run. And I don't know what's gonna be the next video, to be really honest with you. Guess what? We do know the results. I did the MRI, I recorded what I could, so you're gonna see that in the next video. And you'll see how I'm treating, how I'm feeling. I have updates. See you in the next video.